Almost. Thanks for joining us today. As we know, the novel coronavirus was discovered a week ago in the state of Washington. Since then, there has been a tremendous collaborative effort between local jurisdictions in the state and the federal government on this front. This is one of the largest public health care mobilizations in the history of the state of Washington, and it's appropriate that that's the case. More than 200 people are currently working on these efforts to preserve health and safety in the state of Washington. It takes a lot of people to track down the contacts of anyone who has been contracted this particular disease. So I can say it's all hands on deck on this issue right now in the state of Washington. I called an emergency meeting of my cabinet earlier this week in an effort to coordinate all of our state agencies to be prepared to provide resources in this effort. The Washington State Department of Health has partnered with our State Emergency Management Division to stand up our State Emergency Operations Center at Camp Murray, just south of Tacoma. The reason we are taking these actions is the potential exists that we will need substantial more resources than are on hand today. The Joint Information Center has been established at the Emergency Operations Center with representatives from multiple agencies to coordinate these efforts. We're marshaling the state's resources and activating other state agencies to assist, as I've indicated. The Washington State Healthcare Authority, the State Department of Agriculture, and the Washington State Department of Fish and Wildlife are contributing to this work in assisting all of the levels of agencies in this work that's being done. So we are not restricting our response just to identified state agencies. Many other public servants across the state are giving their time and energy to protecting the public, and we're deeply grateful for that. We are fortunate to have a strong public health system in the state, and this response is evidence that our government is operating with an all-hands-on-deck approach. Our state and local health departments will continue to work closely with the federal CDC, with medical providers and others to monitor this virus and provide care and support to anyone who needs it. I have asked the CDC, both via phone call and by letter that went out today, to extend an enhanced screening protocol at SeaTac Airport. And I've asked that that protocol include temperature and health history of people entering SeaTac from regions of China that have been affected by human-to-human transmission. I believe Washingtonians have a reasonable expectation that these screenings will include a temperature and review of the health history of the individuals before they enter the state. To date, the CDC has not seen fit to do that, but we will be in continued conversation with them. As I said last week, public health and safety, as well as the health of our patients, is of paramount concern right now. But I do want to make clear something I think is pertinent to people in Washington as we go about our lives. There is not a reason to really change our enjoyment of the state of Washington right now. I am not curtailing my public meetings. There is no reason to curtail public meetings in the state of Washington based on evidence at the moment. So my thinking is we should continue to enjoy the games we go to and the music we enjoy and the sociability that we enjoy in the state of Washington. And we are not suggesting anyone be hesitant to visit social activity. We are suggesting that people consider doing the things we should be doing anyway, which includes getting your flu shot if you have not already, and doing the things to protect ourselves, which is washing our hands and covering our mouths when we sneeze. That still is the case. I'd like to turn it over to King County Executive Dow Constantine, who runs a county that's doing fantastic work in their local response. Dow.
Well, good afternoon. Thank you, Governor, for joining us in King County this afternoon. We are very grateful for your support and partnership. Our world is tied together more closely than it has ever been, and we are better off for it, particularly here in our region. We thrive and we prosper on our international connections, on trade, on travel. Our community is enriched by the many cultures around the globe who have found a welcoming home here. Those connections also present modern challenges. Infectious diseases that might historically have traveled slowly now can arrive on our shores in a matter of hours. In our county and our state, we have to be ready anytime for outbreaks in any part of the world because they could be at our doorstep the very next day. What we're seeing unfold in China is very concerning. While we're fortunate that we have not yet seen sustained transmission of novel coronavirus in the United States, we must remain vigilant. Now, here's the good news. We are exceptionally fortunate in this corner of the country to have some of the best public health experts and partnerships anywhere. These professionals monitor disease outbreaks constantly, and they plan accordingly. So when we saw the nation's first case of novel coronavirus in our neighboring Snohomish County, everyone jumped into action, and they knew exactly what to do. Working with the CDC, our county and state disease detectives are working to protect the public by watching for new cases and acting quickly to contain them when we find them. In King County alone, we have over 50 public health staff workers working on shifts 24 hours a day, 7 days a week in response. Our staff is helping thousands of local healthcare providers understand what to look for and taking calls day and night. They are making symptom check calls on those who've had close contact with the confirmed case in Snohomish County, and we are providing them with support. In addition, we've tested 10 people who met the CDC criteria to be checked, and at this point, 6 of those tests have come back negative, and 4 of them are pending. In all these cases, the patient had to be isolated. We make sure that they have the food and necessities so that they can stay in isolation as we monitor their health. We also gather information about their recent history and their close contacts and monitor their symptoms as well. Beyond that hands-on work, our staff is preparing new fact sheets and providing guidance every day to our partners and to the public to answer their questions and to help them understand what it is they should be looking for. Our public health systems are responding well, but I can understand that watching the reports out of China may frighten people. Unfortunately, that fear can lead some down darker paths. Right now, we're seeing some deeply misinformed and hurtful judgments being cast against people of Asian heritage in our community. This mostly surfaces on social media. Now, let's be clear, and I can't believe I have to actually say this out loud, a person's race or nationality has nothing to do with the risk of spreading novel coronavirus to another person. Stigma is not going to help us fight this outbreak, but it will hurt innocent people. Please help us by spreading facts and the knowledge about this outbreak from reputable sources like the CDC and the State Health Department and your county health department. The only way we're going to succeed in our response is by joining together as a community, not splitting apart. And I know we can do it because we already are. I'm encouraged by the efforts I'm seeing with our partners here and our partners across the healthcare sector. And I know people and businesses across our community want to do the right thing for their families, for their neighbors, for their staff. We will continue to monitor this outbreak closely, and we will learn more every day. And when we do, you can expect us to keep you informed on how to protect your health and the health of your community. I'm grateful to everyone for their efforts in stepping up to this challenge, and I'm grateful for all of our regional partners, including our partners in Snohomish County. It's my honor to introduce Snohomish County Councilmember Stephanie Wright.
Good afternoon. First and foremost, on behalf of the entire Board of Health and Snohomish County Council, I want to share how incredibly proud I am of the amazing team at the Snohomish Health District. They responded immediately and have been nimbly adapting to a continuously evolving investigation. They have been thrust into a national and global spotlight, working alongside colleagues from the CDC, state, and local public health partners to develop processes and procedures that will guide future investigation and response efforts. The team continues to do a daily monitoring of 29 of the 67 close contacts statewide. 2 individuals from Snohomish County have been tested, and the results are pending. Our 1 confirmed patient remains in satisfactory condition, and the timeline for discharging this patient is still fluid. At this time, I'd also like to take the opportunity to thank some of our additional partners in Snohomish County who have rallied around our health district team. First, volunteers with the Medical Reserve Corps that have helped staff the call center last week. They also remain on alert should additional resources be needed. Next, the Snohomish County Department of Emergency Management has been offering support and coordination as this effort has expanded. We have also activated the county's Joint Information System, working with cities, schools, law enforcement, first responders, and countless other partners to help get information out to our communities. The complex and intensive work surrounding this coronavirus case, coupled with a recent epidemic of hepatitis A outbreak in Snohomish County, has quickly taxed our agency. Since January 19th, over 675 hours by 30 employees have been dedicated to these response efforts. To put that in perspective, that's 1/4 of our entire agency. So while some activities have been delayed, our public health team is doing our best to keep regular business moving. Even as we manage a growing health concern, we continue with our daily efforts to support the community by inspecting restaurants, issuing birth and death certificates, treating tuberculosis patients, and stopping the spread of countless other diseases. Public health is essential to monitoring and coordinating emergency response, keeping our communities safe, and protecting our local economy. And as we've seen over the last week, Snohomish County and Washington State are in great hands. So thank you. And at this time, I'd like to turn it over to the Secretary of Health, John Weisman.
Great. Good afternoon. Thank you. I want to thank our elected officials for their leadership and support. This has been really incredibly important for us as we move forward in mobilizing our response. You can tell they're very engaged and paying attention as they should be. So as was said, I'm John Weisman, Secretary of Health for the state of Washington. This afternoon, I want to give you an update on the statewide situation where we are with the novel coronavirus here. As of this morning, we hold steady at 1 confirmed case of novel coronavirus in a male in his 30s who remains in satisfactory condition at Providence Regional Medical Center in Everett. We continue to assess the patient's condition and work with his medical team and public health to determine when it will be appropriate to discharge him from the hospital. I would like to thank the medical providers and the staff who continue to care for him. I was just up there this morning, and they're doing an amazing job. And we very much appreciate the cooperation of the patient and with our public health interviews and with his care. So far, we have a total statewide of 16 persons who have gone under testing for possible coronavirus infection. 1 of those, as you know, has tested positive, 7 have tested negative, and we're waiting the test results on 8 more. 67 close contacts from our patient are being actively monitored by local public health, and you've heard that, and you're going to hear more from our King County Health Department about that in a minute. As you've heard, these are daily check-ins with the patients or the folks that we're actually monitoring to check for any symptoms, whether they have fever or cough or difficulty breathing. Those are the symptoms that go along with coronavirus infection. The Department of Health website is updated every day at 3 p.m. with the number of close contacts and the test results, both positive and negative. You can visit doh.wa.gov for that information, and you'll get our homepage, and you can link at the very top to our coronavirus information. While this novel coronavirus is a serious public health threat, I want to reiterate the risk of novel coronavirus to the general public in the United States is currently low. Since the virus can cause severe illness, an outbreak, as you know, is growing in China, we have expanded our response to this situation so that we are absolutely prepared should we have more cases of novel coronavirus in Washington. We at the State Department of Health have over 100 staff working on containing this outbreak, and we're doing so with our local public health partners and with the State Emergency Management Division and our healthcare providers. We are leaning forward to do our absolute best to stay ahead of the situation. The Department of Health has responded to 26 incidents over the last 6 years, ranging from wildfires to natural disasters to communicable disease outbreaks, along with our local public health partners. While our responses are similar, diseases are spread in different ways. Because of that experience, we know it's crucial to be proactive and to be prepared. Our public health system is working. As you have heard, we literally have staff responding to this event 24 hours a day, 7 days a week. As this investigation gains steam, I know that people are asking, what do I need to do to stay safe? And really, it's what we should be doing every day and every cold and flu season. Wash your hands frequently, keep them out of your mouth and eyes, and if you're sneezing and coughing, cover those and stay home and call your healthcare provider if you are concerned. And as we already said, if you've not yet got your flu shot, get your flu shot. If you've traveled from Wuhan City, China, into Washington State and you have a fever and or cough or difficulty breathing, immediately call your healthcare provider. And if you don't have one, call the call center number at 1-800-525-0127 and press pound. This call center is open from 6 a.m. to 10 p.m. and is available to anyone with questions about the novel coronavirus. Again, that number is 1-800-525-0127 and press pound. I want to reiterate the good work that's being done around the clock by the state, local, and federal public health workers and the healthcare system providers to help stop this infection and to help everyone get the answers they need. It's an amazing effort, and the teams, as the governor said, are really rallying across the state, across our local communities, and that's what it takes for us to do this work. Next, I would like to introduce Stephen Metrick, who is the Executive Director of the Port of Seattle.
Good afternoon, everyone. First off, I'd like to thank you, Governor Inslee and Executive Constantine, for the invitation to be here today to show that we're part of this integrated team that we have in response to the virus. The Port of Seattle operates two critical gateways: Seattle-Tacoma International Airport, the 8th busiest airport in North America, and in partnership with the Northwest Seaport Alliance, we operate the 4th largest international marine cargo gateway in North America. I'd like to remind the public that monitoring and responding to infectious diseases is a daily and hourly job for federal agencies, airlines, and maritime operators. Our joint response plans are reviewed and practiced regularly. That is why we're prepared to respond so quickly to this virus, the flu, or any other illnesses that might come through our ports of entry. And this is a responsibility that we take very seriously. Like everyone involved in this effort, safety is our top priority. And to be successful, we have to be coordinated, and we are. I do want to provide an update on increased actions that we're taking in response to the novel coronavirus. I've directed the senior leaders at the port to establish a task force to ensure that we stay coordinated internally and externally. At Seattle-Tacoma International Airport, the focus remains on personal hygiene. We've increased our janitorial service in what we call high-touch areas. We're using more disposable wipes to disinfect more quickly. We are adding more hand sanitizer machines throughout the airport. Our focus is in baggage areas, restrooms, and where we service international flights. So these may seem like small measures, but these are the most effective measures that we know to combat the spread of viruses and other diseases. As you know, the Centers for Disease Control and Prevention has added enhanced screening at its airports with quarantine stations, including here at Seattle-Tacoma International Airport. We understand that federal agencies are conducting the same screening protocol at maritime ports of entry as well. Of course, any specific questions regarding these screening efforts should be referred to those agencies. Passenger screening is a federal protocol, but we are ready to assist in any way we can at SeaTac. We rely on public health officials to provide the latest risk analysis and recommendations to keep employees in our community safe. We're constantly evaluating additional actions based on their analysis and their guidance. We're keeping our partners and our employees informed through multiple channels. We're keeping members of the traveling public informed with updates on our social media channels and our website, www.seattle www.portseattle.org. And I would like to thank all these partners today for all of their assistance in this efforts. With that, I'd like to introduce Patty Hayes, Director of Public Health, Seattle-King County.
Thank you so much, and good afternoon to everybody. As you've already heard, we have an incredibly strong partnership and relationships in our public health and healthcare system. I'm grateful for them every day, and I so appreciate our elected leaders for their strong support and support of our work based in science and public health practice. I also thank them for their commitment to clear and frequent communications. It's just so very important and really, really grateful. This collaboration could not be more important at times like these, when a new virus reminds us that our community can only be protected when we work together. Public health is stepping up to this latest challenge in the way we always do. Quick action, hunger for more information and knowledge, ingenuity, time that our A outbreak. Here in King County, it's largely affecting people living homeless. With the support of Executive Constantine, we've been able to vaccinate thousands of people in the hopes we can prevent a larger outbreak here that many other metropolitan areas have experienced, with lots of issues and problems for their population. And I'm just proud to say to date, we've avoided that. We still happening, but we're working every day and continuing to work. We're also seeing a rise in HIV cases after many years of declining rates. This outbreak is being driven by injection drug-using populations, which is new. We're one of 5 cities that CDC is looking at where this new emerging. The front lines of developing new ways of working and getting this population into care, tested, and the support they need. We're developing different strategies because that is what it takes, and hopefully we can turn the trend around. We're also in the middle of a continuing overdose epidemic, taking over 400 lives every year in King County alone. The rise of fentanyl use in our region threatens to increase death and suffering. We're working hard with our partners to create more opportunities for treatment and to prevent people from starting using. And it's been a year since our statewide measles outbreak. Seems like yesterday, actually, but it's been a year, which took a tremendous effort by us and our statewide partners, including putting other work aside to bring under control after many months. And that's the top of our normal disease detective work, doing thousands of more routine investigations every year. I'm so proud of our public health staff, from our frontline responders to our data experts and communicators to all our administrative staff that make our work go. They all stepped up to challenges, and I recognize how much we're asking of them. I'm glad they'll have an opportunity to be recognized personally when we leave this room and go upstairs to see our Incident Command Center in action. And now I'd like to turn it back to the governor so that we can have some question and answer time.
Thank you. I wanted to add something before your questions. I'd indicated that the state believes that we should have temperature monitoring of passengers as they come in. This is a technology is pretty simple. You just have a remote sensor that takes your temperature from your forehead. I actually had this done when I flew to China during an outbreak a couple of years ago. We also believe that we ought to have health histories taken by passengers before they enter about their situation and their families. And the reason we're talking to the federal government about that is that the CDC is the entity that makes those protocol decisions. The port is not responsible for those decisions. The port implements them, and we appreciate your work in that regard. So we're hopeful that the CDC looks at these additional screening things. We think that they're reasonable, and we hope that the federal government will adopt that protocol in our airport from places where there have been human-to-human transmission from China. And we think that's the right thing to do. So thanks for your work. Questions? Yes, go ahead.
It sounded to me like the CDC is already implementing measures of all passengers coming in from China of taking temperatures. But you mentioned you were asking for extended screening. Can you clarify? Do you mean when CDC plans?
Yeah, there has been, unfortunately, some confusion about this. We think we've now tracked that down. In fact, for provinces other than Wuhan, they are not taking temperatures where people come in from other areas in China. So what we're suggesting in provinces of China, and there are a number of them where there has been clear human-to-human transmission, we are suggesting that we have the temperature taken by passengers before they enter. We think that this virus, it's called novel for a reason, and we know that there are thousands of people infected already in multiple provinces in China. So we're hopeful that they will extend that, and I'm sure they will clarify it. We have a letter Tara's handing out to you in that regard. Anything else?
Can I just ask about when it comes to flights? So we know that we have some airlines that are canceling altogether. We have Delta next week saying they're going to start to reduce. What is the word at SeaTac Airport with the other two airlines besides Delta that do provide flights? And do you have any concerns that there are still so many flights going between SeaTac and China?
So I'm going to let the port answer this, but I will preliminarily say that we are really hopeful that we continue a tremendous relationship with the people of China, and that business and academic and tourism continue, and we hope that we will return to normal. It's important to maintain those relationships, and we're going to do everything we can to continue that. But the most important thing at this moment is to prevent this from becoming a real widespread pandemic. But do you want to provide any other info?
And to follow up on that question very quickly, the CDC is saying for travelers to avoid non-essential travel to China. We've got lots of people doing business, lots of students, people who go back and forth between the U.S. and China, especially in the Pacific Northwest. Would you care to respond to that?
Well,
Yeah, we can respond to both if you like.
yeah, I think that if there's questions specifically about the airlines, they're making those calls based on business decisions. You know, and we're not privy to those. I mean, they make those decisions on the call. We've seen overall, I can comment that overall it's softening a little bit on travelers right now, but we haven't seen an overall downturn in the number of travelers from China or Hong Kong right now. You know, specifically on that, I mean, the importance of the relationship, as Executive Constantine talked about, that relationship to maintain that trade is very important for the economy and everything else. So, I mean, that's why we're seeing all the responses that we're taking now. You know, regarding that, I don't think you have to see how that works out, but I can't comment specifically on those federal guidelines and those recommendations on that. We're just as the gateway, we're just operating that to make sure that we're working as efficiently as with the federal agencies as possible on that.
The screening started at SeaTac yet?
No, that's a question for CDC on that of implementing those measures.
For public health authorities, right now, the threat of coronavirus in the United States is considered low risk, even though it's a serious concern. What is it going to take to be considered a high risk? I mean, we have one person who's been diagnosed, and we've got 16 others who are being looked at, and the numbers obviously be broken down. What is it going to take to become high risk?
Right. So again, our priority right now is to contain the spread of this virus. And so we're looking to identify individuals so that if they have travel history right now or have contact with somebody who is a patient, that we're able to monitor their health, which public health is doing, such that if they should start showing symptoms, we can actually get them tested. So what we're looking for is if we have sort of sustained human-to-human transmission. So as of this point, we have not had human-to-human transmission of this new virus in the United States. And we have been looking at some of the research and believe that perhaps somewhere between 1.5 to maybe up to 4 people could actually become infected with the coronavirus for every person who's infected. We're watching that very very carefully here. As I said, to date, we have not had any human-to-human transmission in Washington state. So if we saw that this was spreading out of sort of some smaller clusters and started, spreading in other parts of the state in larger numbers, that's when we would be looking at sort of other kinds of measures and thinking about in a particular community whether it made sense to, encourage people to telecommute, whether it made sense to take a look at school closures. So those are why we have these large staff numbers right now who are working and actually doing this planning. But I want to come back to the fact that our priority right now is to contain this. And the way that we contain this is to identify folks who may have symptoms, get them tested, contact their close contacts, and do this monitoring, the work that we do in public health every single day. That's our priority, and that's what we're focused on to prevent the spread.
Do you expect that that number is going to keep growing a lot more, people being monitored and tested, or are we kind of having gotten everyone?
Yeah, certainly. I'm sure we're going to have more cases of the novel coronavirus in the United States. And as you know, from the one patient we've had here, we had 67 close contacts from that one patient. That can vary considerably depending on people, what they did, whether they've gone to work or if they just sort of pretty much stay at home. Their activities vary. So that number of how many close contacts varies greatly patient by patient.
Can I add something to that, John, if I
Yep.
can? I'll just tell you what our state response is. We want to get ahead of this virus. If you're really going to stop a pandemic, you got to get ahead at it. You can't chase it, always be a week behind. So what we have done is to marshal the resources so that we can bring those to bear at the appropriate moment. And that's the thing I hope Washingtonians agree with, that we need to do that, and we are doing that right now.
This may be a question for one of the doctors up here, but there seems to be a lot of misinformation about coronavirus out there. Can you speak to what exactly the symptoms are of this specific infection and then how it's treated?
Yeah. So the coronavirus symptoms, if you have this, right now it would be travel to an area that actually has this or contact with somebody who does, because you can't get this if you haven't been in contact with someone. So it would be a fever and cough or respiratory, difficult breathing, pneumonia. Those are the symptoms that we're looking for. There is no treatment right now for this. The National Institutes of Health, of course, is looking at potential treatments, but right now there's basically supportive care, making sure that they have oxygen if they need assistance in breathing. So so that's the sort of current situation.
Is there any, granted it's a new infection, a new virus, but have the vectors been identified, like exactly how it's transmitted from person to person? Is it touching surfaces, physical contact, what?
Right, great question. So like other coronaviruses, we believe that this is really primarily spread through droplet spread. So that's why we say that somebody who's got symptoms and is coughing would be the way that this would spread most easily, because when you cough, you can spread droplets into the air, and it's really the close contact, being within about 6 feet of someone, and usually for a prolonged period of time, maybe 10 minutes or so. It can also spread by surfaces. So you heard the port saying that they're doing a good job of cleaning surfaces, which is always a good idea, especially during cold and flu season. These viruses we don't think live for a long time on surfaces, but we're learning with this new virus. So, but primarily this is spread through droplet.
So I guess to summarize, this isn't nearly as infectious or as, say, measles, the outbreak we saw last year.
Correct, right. There's a very big difference in sort of how measles is spread through larger airborne, where it sort of hangs in the air, and with measles, which we know from our many years of experience, if somebody was with measles in this room, left in 2 hours you came through the room and you didn't have immunity to measles, you could pick that up. That is not what we're talking about here. We're talking about a very different kind of mode of transmission, really this droplet spread.
Can I just
to ask, is there any work toward a vaccine happening in our state? And then the second question, if the World Health Organization does decide tomorrow to declare it an international public health emergency, does that change anything about response at a statewide level?
So I know we have various folks working at universities on coronavirus here in Washington. I don't know if they're actually doing vaccine studies. The National Institutes of Health is, and so those studies are certainly ongoing, and I wouldn't be surprised if they are. Jeff, I don't know if you know of folks doing vaccine studies here.
Vaccines are really just under development. There
Yeah.
are no vaccines
Right.
available to study at this point.
Right.
We want to talk about doing a test. We are working on a test.
Well, so as you know, the test for the coronavirus right now is being done at CDC. They developed the test a few weeks ago, well, maybe less than a few weeks ago. Ours was the first to test positive. That test will be pushed out to state public health labs in the next couple of weeks so that we can actually do the testing here in state and speed up the results for that and increase the number of throughput that we can get on tests. So we are prepared for that. We have ramped up. We have ordered the equipment necessary for all of that, which is, again, the governor talking about us being fully activated to make sure that we're ready for those things and are prepared to do the testing. And
World Health Organization, does that make a big deal if they announce that tomorrow?
I mean, I think what it basically simply says to us is that, yes, multiple countries have this as an international community. We have to take this seriously, which obviously we are. So from our operational perspective here in Washington, for us, it doesn't really matter. We are full bore on working on this and have mobilized the staff that we need to make sure that we stay ahead of this.
Since you're at the hospital today, can you give us a better idea of the condition of this one patient beyond just saying satisfactory, and why that patient is still hospitalized? Is there a reason for it? Is it a quarantine thing, or is this person really ill?
Right. I can't speak specifically to the patient in terms of patient confidentiality other than to say the patient is in satisfactory condition. Being the first patient, we are working very closely with CDC and the medical team up there about when it would be appropriate to discharge the patient. We are doing additional testing of the patient to see if the virus still is in the blood and in the other samples. And so all of that is being looked at by the medical team and determining when's the right time to discharge him.
And then those dozens of people that are being monitored, are those people allowed to move freely about their lives at this time?
Right, so the close contacts, those who are under monitoring, are allowed to move freely. They have the daily contact with public health around any potential symptoms that they might have. As soon as they develop symptoms, whether it's a cough or a fever, they are asked to immediately notify public health and then immediately isolate themselves. So if anybody starts showing symptoms, they primarily are isolating themselves at home, staying away from the public, and this is exactly what we want. And it's the reason that one way that we're going to help stop this is that we do have this close monitoring of those close contacts. Because once they develop symptoms, we think that then they could, through droplet spread, transmit this infection. So having them at home, getting them tested, prevents them from having close contact with others. And that's what public health is doing every day right now, working with those 67 contacts. James, did you want to add something?
So I say at this
Introduce
point,
yourself.
what? James Appa, Communications Director for Public Health Seattle and King County. Do we have take one more question, or if not, we will take you upstairs to see our incident command room and see public health staff hard at work.